Hi, everyone. My name is Paul Stone. I represent MSU Denver Strength's Spring 2021 intern class, and I am here to present on auto-regulatory progressive resistance exercise, otherwise known as APRE. Let's get into it. So there are four main individuals who all have contributed significantly to the APRE method. It all began with Dr. Thomas DeLorme, pictured to our top left. Dr. DeLorme was a military surgeon who was exploring new ways to rehabilitate broken legs so that once recovered, the losses of muscle size and strength were minimized. He developed a 3 set by 10 rep protocol that had his patients perform respected intensities of 50%, 75%, and 100%. And once we get more into the details of APRE, we will notice how by doing this, he laid the foundation for the program itself. The next main player is Dr. K.L. Knight, and he is responsible for adding the 4th set to DeLorme's protocol, as well as an adjustments chart to accompany it. He was also credited for creating a protocol for sets of 6 reps, which made this early rendition of APRE into a strength-based program. Following him, we have Dr. Mel Siff, who first introduced the term APRE in his book Super Training, and also detailed APRE 3, APRE 6, and APRE 10. This, of course, is the first time APRE has been introduced in a strength and conditioning format. And finally, we have Brian Mann, a legend in the field who is currently at Miami. Coach Mann's book titled The APRE is now the go-to strength coach's guide to implementing APRE in the weight room and is largely responsible for the information in this presentation. Now, moving on to why we use APRE and how. I'll begin with a quote from Brian Mann's book, where he refers to it being, quote, the epitome of progressive overload and the said principle, end quote. A quick refresher on these two terms. Progressive overload has the athlete lift heavier and heavier loads over time. And the said principle, which stands for specific adaptations to impose demands, states that the human body can and will adapt to whatever stressful demand that is placed onto it. Next, it almost goes without saying that the purpose of using this method is to get stronger. But it can also yield results in hypertrophy when working with APRE 10 and APRE 6. Now, to the layman, strength and hypertrophy may appear to be a sort of package deal. You can't have one without the other. But of course, as strength coaches, we know that strength gains can be increased without significant growth in the size of the muscle through the formation of new cross bridges and adapted neurological system. That brings us to how we use it. We will, of course, get more detailed in the upcoming slides, but APRE is mainly to be performed with core lifts. These lifts are always compound movements, lifts like the squat, bench press, deadlift, for instance. Some may wonder if this method can be used with Olympic lifts. Absolutely. They, of course, are more technical and would require adequate time and training age of an athlete in order to implement in programs. APRE is best suited to be used for the first or second movement of the workout. This is because of the taxing effect it has on an athlete's energy. I mentioned that it can be the second movement. This is only when there is a non-APRE Olympic movement in a program, which should be done first due to the technical aspect of the exercise. All accessory work should not be done following APRE protocol, as it will exhaust the athlete and hinder the main movement's results. And last, only perform 1 to 2 APRE movements a workout, but preferably only once a workout. This shouldn't be an issue for the collegiate coach because coaching APRE can be highly challenging for just one movement a workout. So now we will get into the specifics of how the APRE protocol works. Right off the bat, we see that there are 3 options, APRE 10, 6, and 3. These numbers represent the target rep amount that an athlete will be aiming to surpass once they get into their 2 working sets. Because Brian Mann suggests that it is best to go from higher rep protocol to lower rep protocol, we will be referring to APRE 10 for the remainder of this instruction. Now, right off the bat, we notice that there are 4 sets, which is consistent no matter which repetition protocol you choose. In most strength programs, intensity is relative to a 1 rep maximum. But in the case of APRE 10, you base it off of a 10 rep maximum. And APRE 6 is based off of a 6 rep max and so on. Because our slide is using APRE 10, set 1 will be a 50% of your 10 RM and be performed for 12 repetitions. Set 2 will be set at 75% of your 10 RM and performed for 10 repetitions. Now, again, it doesn't matter which protocol you choose. The percentages for sets 1 and 2 remain the same. However, the reps required may vary due to the rep maximum you're referencing. If you look over to the top right, we have the protocols for APRE 6 and APRE 3 in case you wanted to train for strength. Now it is time to get into sets 3 and 4, where we begin to understand the autoregulatory component of APRE training. In set 3, the athlete will be working with 100% of their 10 RM. In the next slide, we will see a proper example, just so we know how it can be applied. The catch is that the athlete is aiming to perform at least 10 reps, but is encouraged to exceed the number until they reach technical failure. Once they have completed set 3, they will reference an adjustment table specific to their protocol. For our APRE 10 protocol, the table can be found in the bottom right of this slide. This table will indicate how much weight, if any, to add or subtract from the lift. Intuitively, the chart depicts that weight should be added if the lifter surpassed the 10 rep mark, and that weight should be decreased if they underperformed. Whatever the case might be, this new weight will be the load used in set 4, in which the lifter will again attempt to surpass the 10 rep mark until or unless they reach technical failure. After set 4, the athlete is finished with that workout's APRE lift, but the numbers game is far from over. Whatever weight the athlete performed for their 4th set will be the new 10 rep max for the following week's APRE workout. The only time this may be changed is when you, as the coach, notice any glaring issues that contraindicate an increase of weight the next week. This can be poor technique, body mechanics, or other things, but it is your job as a coach to catch this so you can adjust accordingly. Okay, so now let's pull it all together and show you a completed sample program. Week 1 begins with APRE 10, where an athlete is performing a back squat as their core lift. They have a 10 rep max of 225 pounds, and they use this as reference for the duration of week 1. After knocking out their 2 warm-up sets, they perform 100% of their 10 RM, 225 pounds, for 15 reps. This, of course, is well over the benchmark of 10 reps, and we refer to the 10 RM protocol to our top right and determine they can add 10 pounds to the bar. They perform 235 pounds for their 4th set and do well, which means 235 pounds will be his new TRM or 10 RM for week 2. Week 2 is much of the same. They handled their new weight well, and by the 4th set, the athlete is back squatting 240 pounds. The big thing I want you to take away next is the transition between week 2 and week 3. Now, normally we would not transfer APRE 10 to APRE 6 after only 2 weeks, but for the purpose of the example, we will. Whenever you change protocols during a program, you must always go down to the next lowest rep protocol. When trying to determine what the 6 RM should be for week 3, simply reference the previous week set 4 to the new 6 RM protocol. In this case, set 4 of week 2 was performed for 9 reps, so week 3 6 RM is 250 pounds. Now that the APRE method has been explained, here are a few things to consider when you are both a coach or an athlete. The first is the concept of technical failure, a term I used in the last 2 previous slides. Technical failure refers to the point in a set where the lifter cannot perform a repetition without breaking technique. In the example of a back squat, technical failure can be identified by inadequate depth, knee valgus, and etc. It is important that a coach stress the importance of performing repetitions properly so that an athlete knows when they themselves have reached technical failure. Moving on to psychological motivation, APRE increases it by being designed to where athletes can push past preconceived boundaries and limitations. This will in turn boost morale during a lift and is one of the many positives of the method in general. The last one pertains to you as the coach primarily. Sometimes you will notice that an athlete is performing exceptionally well on a given weight, and the adjustment chart's recommendations may be too frugal on the athlete's true capability. It is here as a coach where you can manipulate the weight, even if it is higher than the suggested increase, in order to make sure the athlete is properly pushing themselves. Finally, let's cover how APRE can be used in groups. In small groups, you can afford the luxury of having your eyes on most of the lifters at once. It is your job as the coach to monitor form and know the adjustments between set 3 and 4 like the back of your hand, in case if asked. When working with large groups, you can take it upon yourself to familiarize the athletes with the adjustment chart. That way they can adjust weight themselves. Since it will be more difficult to monitor all the athletes at once, a foundation of proper technique must be installed into your athletes. And of course, Have as many coaches available as you can to continue monitoring the lifts. And that concludes my presentation on APRE. Thank you to Brian Mann for his contributions to the education of APRE method and strength training in general. And of course, to my mentors at MSU Denver, Isaiah Castilleja and Jordan Ulrich. And here are my references. Thank you for watching.